Okay, now that we are recording, we will go ahead and start this meeting again. Thank you all for joining today's town hall meeting on sign language interpreters. I'm really looking forward to engaging in tonight's discussion about different topics as it relates to licensure and what will happen moving forward. We will see some presentations, and we do have interpreters. If you are not an ASL interpreter, please change your name in Zoom. We would appreciate that. Next slide, please. So this is today's agenda. We will start with the board makeup, the board goals, followed by the regulations, the grievance processes, the web portal, and then we will open up the floor for questions and answers. If you want to ask questions during the town hall, you can ask them via chat, and we do have persons monitoring the chat and transferring those questions into a Google Doc for follow-up. So during question and answer time, we will be able to address some of those questions posed throughout the town hall. And those that go unanswered, we will post in a FAQ to make sure that everything is addressed on our website. Next slide, please. So we're going to introduce the current board. Obviously, my name is Jacob Leffler. I'm currently the board chair, and they've been changing every year, but I am the current board chair.
Hi, good afternoon. My name is Leslie Puzio. I'm an SBLI Vice Chair. Hello, everyone. Hi, I'm Susan, Sue Beaver. I'm the community member here on the board.
Hello, everyone. I'm Richie Bryant, and this is my name sign, and I'm a board representative for MDAD.
Hi, I'm Paige Franklin. I'm the deafblind representative to the board.
So we currently have two vacancies, the community member and the PCRID representative. So GODHH is opening the floor for nominations. That's already been posted to their social media, and we are in the process of collecting those nominations. So please put those nominations in the chat. So please post a nomination form in the chat, please. Thank you. So Director Ursula DeBerry and Tania Brown, Outreach Coordination Manager, are here to support this process, and they're available if they can answer questions if and when needed. So thank you all so much for your support in tonight's town hall. So our current status, we the board have finalized the regs, and we have gone through that process. GODHH has posted that information on the website. So the regulations can be reviewed and seen there. And the board is more than open to accepting feedback or any comments that you all have. And after the formal public comment, we can make those adjustments. If you identify any mistakes or anything that needs to be fixed or modified, we are definitely open to your feedback and commentary. So as we go through the regulations process, both formally and informally, the ELR and the DSD, we've clarified those points and we've posted those on the Maryland Register website for public comment formally. GODHH currently is working on the web portal, and we will provide updates later during the town hall. So many of you may be wondering what's going on, and we plan to inform you. Next slide, please. So as far as the Interpreting Licensure Board, our goals are the implementation of the responsibilities placed upon the board by the law and state of Maryland. And so in AELR and DSD. So the establishment of standards for quality interpreting services in the state for the deaf and hard of hearing community, and elevation of the profession while also elevating the quality of life for deaf and hard of hearing persons. Can you run the slide before? So now we will discuss the regulations for general license and provisional general license, agencies and businesses, specialty licenses for education and specialty license, the PSL education. So we have four: the general license, the provisional license, the specialty education, and the provisional specialty license for education. Other specialties are currently on hold until 2026. The board has voted previously. That's at September's meeting. Next slide, please. So general license. Next slide, please. So for the general license, regulates that you hold national or regional licensure, and that could be through RID, BEI, or NAD certification. We accept those for licensure. So the board has discussed and has been working on the criteria for the general licensure. So that means those who do not have certification. And so we are working on establishing those criterion later, and we'll do so in subsequent meetings that will begin in December. So the fees for licensure are the initial application is $150, and then the renewal will be $100. Next slide, please. So the provisional general license mandates that the interpreter pass the knowledge and ethics exam with the provisional general license, working in legal, educational, medical, and mental and behavioral health is prohibited, and we will elaborate on that point. As it relates to medical and mental and behavioral health, it is allowed, but in the form of a formal mentorship. As it relates to those fees, the initial fee is $300 for a span of 3 years, well, up to 5 years really, and then you can renew for 2 more years. So it's 3 years and then the renewal for 2 more years at $100 until you can obtain full licensure. So there's a max of 5 years. Next slide, please. Now we're going to discuss agencies and businesses. I'll invite Paige to explain. Paige. Paige. We're having a tech issue. 1 second.
Great. Apologies about my technical issues. My camera, of course, wouldn't work. So this definition of agency is here. An agency is any for-profit or not-for-profit organ entity that provides or arranges for sign language interpreting services in the state for any individual or other entity, including but not limited to for consumers, government agencies, places of public, and for employers. They are responsible for providing only licensed ASL interpreters in all situations. They would register with GODHH, the owner and business information, the types of interpreting services they provide, proof of legal existence, and proof of good standing with the state. You can go to the next slide. In regards to VRI, all VRI assignments, emergency situations, on call, pre-scheduled, Maryland-based interpreters who work from home and in other states, any consumers or businesses who are based in Maryland. This does not include VRS. The fees would have an initial application fee of $250 and a renewal fee of $200. Next slide. Thank you. Hopefully I now can turn off my camera. My part here is done.
Spotlight me, please. So now Susan or Sue will discuss the specialty license for education. She is taking the lead on the work group for the specialty license in education. So Sue, please come on screen. Sue? Sue? Are you spotlighted? No, you're not spotlighted yet. Spotlight, Sue. Okay.
Hello, everyone. I am presenting about the specialty license education. Next slide, please. Specialty license education. You should have a current valid RID, NAD, or BEI certification, or, and I emphasize on the or 4.0 on the EIPA. The EIPA can be either in PSE or ASL. You must pass the assessment with the appropriate grade level for it to apply. Educational interpreters who currently have a required written score are not certified as of yet and cannot work in K through 12 or age 0 to 21. The fee associated is the initial application of $75 with a renewal fee of $50. You are available to renew every year. There's also a requirement of 1 CEU in educational interpreting or any relatable topic, or a 0.5 of CEUs required of PPO training, which includes deaf culture, deaf awareness, and diversity in education. Those CEUs will remain in good standing for 2 years. Also, I should mention at our previous meeting, there is a requirement of having a bachelor's degree. Excuse the interpreter, removed the requirement of having a bachelor's degree. The reason for that is that the board was concerned that the interpreters we will have a lack of interpreters due to that requirement. We do know there's interpreter shortage that we're currently dealing with, so we decided to remove that barrier at this time. However, the EIPA, the assessment exam, may become a requirement in the future. And at that time, we will reevaluate that decision again. Thank you, Jacob. Back to you. Oh, next slide, please. Oh, just one more. Back to the provisional. Thank you. For the provisional specialty license in education, you must have a passing score on the written EIPA assessment. The provisional license is good for 3 years with an option of a 2-year extension. And you must apply for the extension. That means you have a total of 5 years to be able to hold a provisional license. The fee involved is an initial application fee of $150 for 3 years, and then a renewal of $100 for 2 years. And again, that is only a one-time fee because you only have 5 years with a provisional license. Next slide, please. Back to you, Jacob.
Okay, so we've talked about the general license, the license for educational interpreters, and the provisional license, some of the limitations where interpreters can work. Regarding internships and practicum students, they are allowed in different settings. Interns and practicum students must register with an accredited college or program, associates or a 4-year bachelor's or master's. They must be enrolled in the program. Of those students who are not intern or practicum students, for those students, they must be paired with an interpreter in mental health center and educational settings. They are not allowed to be in legal settings. However, in the other settings, they are able to be there with a standard certified interpreter, behavioral health, emergency medical. And then we'll hand it over to Richie.
Yeah, I'm just waiting to be spotlit. Okay, perfect. Now we're going to be discussing about the grievance process. Really, it's just the core of the organization and the process. Next slide, please. It's important to know when you do file in your grievance process that you will not be named anonymous. You have to put your name in. Another thing, who's responsible for collecting this in the grievance process? Firstly, it would be Maryland Office for the Deaf and Hard of Hearing, and they will be the one who will take down that information in relation to documents and or documentation. Once OAH reviews the documentation, then they will contact and provide a hearing for OAH. And that's really just the Maryland state's hearing process, and they're a neutral party. And OAH's responsibility is to monitor, and after monitoring, they will note take and document their findings. And again, they're not providing their opinions or subjective matters. It's purely objective and factual. And they will outline what the laws are. And once they are note-taked, then they will provide their own recommendations as to go forward. Once that takes place, a judge will go through the discussion and see both parties in arbitration and see the litigant party and the defendant party. And once everything comes to its conclusion, a decision will be made, and the board will not be making any decisions. To emphasize, it will only be OAH. there's one part I wanted to go back on. When someone does file and becomes a part of the grievance process, your licensure doesn't immediately become revoked. It becomes in something we call due process. Now we'll be going on to the next slide. This is to discuss about the portal for Maryland Deaf and Hard of Hearing and to outline exactly what the web-based portal will look like. And I will be passing it off.
Hello, everyone. We're going to have a quick discussion about the web portal. Next slide, please. When you register, you have the ability to use this website for registration. Here's the link readily available for you. I recommend you go in just to see what the website looks like, but the link is readily available to you. Unfortunately, the web portal is not readily available at this time. The portal does follow registration, but we're not entirely sure as to when it would go live. One moment, please. The portal is not ready because the regulations has not been published. They are not readily available for the public. We are still in the process of getting those regulated.
So now we're going to open the floor up for your questions and or comments. We do have a few ground rules. We want you to raise your hand and be called on. If you are going to assign your question, we're going to answer your question if we have the ability to do so. Make sure you identify yourself. We are to use one language, and so please do not simcom. And we're going to follow the 2-minute rule, so 2-minute commenting, and we're going to max you out at 2 minutes. And as more questions come to mind, feel free to reach out to the board or GODHH at our email address, gov.odhh@maryland.gov or sbslimd@gmail.com. So we're going to look at our document to see if we have any questions that were accumulated during the explanation of the different licensure. And we do have one question related to the the one-time renewal fee of 100. There's a clarification requested. I'm not really sure which one you are referring to. So renewal for there's an annual renewal fee for the provisional is one time, and there's a max of 2 years for that provisional renewal. Are there any more questions? We want to open the floor for those questions. We see some hands being raised. GODHH, please let me know who has their hand raised. Steve? Steve Fun?
Yes, I'll be using spoken English.
Interpreter, please come on screen.
I think so. Once the portal is live, is that when the 6-month grace
Hold on one
period?
second. Hold on one second. Hold on one second. We need
Sure.
to spotlight the interpreter. Okay.
Thank you. Once the portal is up and running, is that when the 6-month grace period will start? for interpreters to pay their fees?
Can you say the question again? You were freezing a little bit.
Oh, I'm sorry. Once the portal is up and running, is that when the 6-month grace period will start for interpreters to pay their licensure fees?
So in the current regulations, we already have a policy for that. And so the policy at present is that it becomes effective on July 1st, 2025. So at present, the board is looking to make changes if necessary as we go through the processes. So everything right now currently is in process. Do you mind stopping the screen share, please? Thank you so much. That's a lot better. And so we can go on to the next person who had their hand up. Who would that be? Mark Morrison? Hello?
I'm going to sign my question. Regarding businesses, I know licensure was set up for interpreters. That's the law. How can the law require a business to follow the requirements that were laid out in the presentation today? And I need to clarify for the interpreter, excuse me. Licensure for individuals. However, if a law has been passed, so my question is, are there any laws that require businesses to follow these type of criteria? The interpretation was clear. You ready? Okay. Go ahead. Sorry.
So according to the regulation right now, we're only asking agencies to register through GODHH. So that means that the business name, the owner information, that they are in good standing as a business entity in the state of Maryland, and they are committed to hiring licensed interpretation. So those are the current criteria that is requested.
And there is a fee attached to that?
Yes, there is.
An additional question. There are interpreters here in Maryland who are themselves an LLC or a business. They do not employ interpreters, however, they themselves are a business. Are they then required to have each registration, one license as an interpreter and then register as a business?
We're going to have Leslie come on screen to address your question.
Sole proprietor.
That's a great question. LLC, sole proprietor, I'm sorry, LLCs and S corps are required to register. Sole proprietors are not required. The intention is that an LLC could submit a 1099 to other people. Sole proprietors, they do not hold an EIN, so they would have their business obligations be separate. So the sole proprietors do not, LLCs and others do. And to give a little more information, we don't want to put the full burden on the interpreters. Agencies also have a responsibility in this, so we want both parties to be invested. Thanks for the question.
Okay, go ahead and spotlight me, please. This is Jacob. Thank you. The next person will be Philip Meacham. Wait 1 second. Okay, hello, hello.
Hello. Hello, everyone. My name is Philip McKim. Unfortunately, my deaf-blind partner is DeAndre, was not able to join us today for medical reasons. But I just wanted to make a comment. Will the licensure law also include non-competing contracts? Because the two concerns I have is interpreting agencies that may contract with other interpreters may cause like a shortage of interpreters. I've went with my partner to several medical appointments in the state of Maryland. There's one that's it's a non-competing contract, and that again forces the deaf-blind individual to use the VRI system. What do we do in these instances? It's been a long fight, roughly about 2 months of us continuing to remind them that language access or the language line that they're using is technically a non-compete contract. Therefore, they are unable to hire outside interpreters or have the ability to bring in in-person interpreters. Oh, I'm hoping maybe we can continue to partner with these agencies to remove that barrier, because I do feel that it is continuing to hurt the community, especially the deaf-blind community. The VRI system is not a safe discipline for us to be able to use for important assignments. So I just want you all to consider the deaf-blind community.
Thank you for raising your concerns. We definitely see and hear your comment, but I wanted to address one of the points that you mentioned as it relates to VRI. In the law as it stands, it already explains that for blind, deaf, and hard of hearing persons, they have the decision to choose between VRI or in-person interpretation services. And the hiring entity or the provider of those interpretation services must oblige. They cannot obligate you or force you to use video remote interpretation. When it comes to non-compete clauses, board, do y'all have an answer for that? Do we answer? As far as the non-compete, that is not in law. And so we don't have any control over that. My apologies.
I just wanted to make sure. Thank you so much for your answer.
Thank you. Who's next? So now we're going to review our list of questions. We received quite a few. So there was a question about if the organizations like hospitals or who have staff interpreters, should they register as a business to be able to provide licensed interpreters for their consumers? So the answer is no, that hospitals are not required to register. Only the interpreting agencies are required to do so through GODHH. Okay. We had another question. Was there a proposal for developing a standard form for the different specializations so that they can be transparent as it relates to the dialogue and conversation with agencies to be later included in the specialties as they assign interpreters to different jobs. So in an effort to protect agencies or interpreters from liabilities. So thank you for your comment. So we have two more questions related to the educational specialty. So that's pre-K to 12th grade only. So for post-secondary settings, it does not apply. And so really from pre-K, birth to age 21. Hmm. So the bachelor's degree requirement was removed from the educational specialty. We've already discussed that. There was also a concern for requirement of licensure. In our current regulations, there are no requirement for a college degree at present. Yes, we do recognize that RID does have the requirement for a bachelor's degree, and that is their respective decision as a sole entity. But as far as as registration goes, that does not apply to us. Someone asked about the bachelor's degree requirement removing and that reducing the pool of interpreters. At the same time, there was a concern for the licensure requirement. So the educational specialty requires the EIPA of 4.0 or higher to show competency. That goes beyond what a degree would prove. Richie Bryant, did you want to make a comment?
Yes, I wanted to respond to T. Watson in relation to your concern of an insufficiency of interpreters with removing the degree. So really, licensure is the same. We put that in place of the bachelor's degree. So really, it's just about putting responsibility, or you could say accountability. Really, the goal is deaf community people in the deaf community need to be serviced by people or regular interpreters who have that same type of educational experience. So again, it's about having some form of accountability, whether it be not having enough interpreters, whether it be a shortage or not. Really, the design and the purpose of the community is to have a pathway. And again, it's all about the grievance process, and that's the importance of it. And that's what we're talking about.
Did we answer your question, T. Watson? I'm assuming that it was answered. Perfect. Thank you so much. So our next question is tied to fees. Does it apply to both deaf and hearing interpreters? So the answer is yes. So our next person with their hand up is Eddie Martinez.
Hello, my name's Eddie. I'm deaf and blind. I have a three-part question. Part one, I would suggest to add the word deaf-blind in the law. Part two, I want to have deaf-blind there in the same level as deaf people. Also, and a thought that I have about interpreter training, that we need to increase the number of educational interpreters instead of reduce them, because we don't want to have a negative impact on the deaf education system and the success of our deaf students. I'm wondering if the score needs to go up, or the CEU requirement needs to go up and not be reduced for educational interpreters. And third, VRI, make sure that it must be the interpreter needs clarification.
Eddie, I'd like to address your questions. Oh, the interpreter needs clarification.
As a deafblind individual, I use tactile signing. And so if they offer me VRI as an option, it will not work as an interpreter, period. And that type of, I want VRI out. I want to make sure that I'm guaranteed an in-person interpreter. And I need that somewhere on the list for deaf, deaf hard of hearing, and deaf blind, because I don't see deaf blind reflected in your documents.
Thank you. Thank you so much. So to address your second question, as it relates to CEUs,
Yes, I think the required number of CEUs should be increased to improve the education of deaf and hard of hearing children.
okay, Paige will answer or address this question.
This is Eddie, this is Paige. Paige Franklin, we have met at Gallaudet University. Regarding your 3 points, yes. Deaf blind, the term is not in the regs, and there are plans to add it. In one of the phases upcoming, we're currently dealing with the regs, and we're starting with the basics, and then we're going to move iteratively, and deaf blind will be added into the regs. Yes, I see. You want it now. I understand that. That is clear. One of the things we want to do is to set up a work group. I will invite you, Eddie, and in that work group, we will discuss your 3 points. CEUs and the EIPA. Is that correct? Okay. That is very important feedback that you have given us and that we need to include in our discussions. Regarding deaf blind interpreters and CN, and we will add that navigators. And there was something else you mentioned? Oh, VRI, yes. If you saw the comment regarding earlier in the meeting about interpreting with Andre, I'm not sure. They went to MedStar and they were asked to use VRI because there's a non-compete clause in the contract of the interpreter service provider. Those medical facilities are not able to contract with a secondary interpreting agency to provide the resources needed, and that causes issues for deafblind individuals. One of the things I'm planning to recommend to the board is to add some language about this non-compete clause and that it can't be allowed. Deafblind individuals need to have the option to choose the interpreters. And Eddie said, thank you, I understand. And Paige is asking, do you have any additional questions? And Eddie says, no additional questions. Paige says, I hope to see you soon at Gallaudet. Great.
Mr. Jacob, I would like to add to Paige's comment. It's already written into law that deaf, blind, deaf, and hard of hearing persons have the right to choose how their service is provided, whether it be VRI in person, whether it be a medical appointment, and the like. And so if they want an in-person interpreter, the entity must respect that request and they cannot force you to use video remote interpretation.
This is Eddie. If I can add, they can't force deafblind people to cancel their appointments last minute as well. I ask for a live interpreter there and they need to keep the appointment. They can't be rescheduling or canceling my appointment because they don't have an interpreter.
Thank you.
I appreciate your comments, Eddie. This is Paige.
Thank you. This is Jacob. So our next person will be Carrie Marcus. Hello.
Hello. Really, I prefer to sign this. My concern is the same as what I've been seeing in the chat. First of all, thank you so much, Mark, for asking that important question. I forgot to mention it. Many interpreters actually become LLCs or C Corp, S Corps, and that's our way of protecting ourselves in the field. I know that we're concerned about regs and the legal language and how that affects us. We do want to be professional. We've already paid the state of Maryland on an annual base when it comes to taxes. And that's just for us to keep our LLC and to keep our S Corp. If now we have to technically pay double, I'm a sole proprietor and I pay for my LLC. If I pay for both of these entities to keep my license, I feel like that's double the effort. How can we ask the board to reconsider that approach? For us who are not a business entity and we're not hiring interpreters, we're not placing interpreters, the business aspect of it is just a protection against ourselves as working interpreters.
Thank you, Reggie Bryant. Richie Bryant.
Thank you for your question and statement. And I myself am a business owner as well. And I've been a business owner for over 20 years. And to clarify, when it comes to an LLC and or S Corp, when you do pay for it, you have a right to conduct business in the state of Maryland. That's what it's pretty much saying. Now, when you have that secondary charge of putting that money towards the agencies, then therefore you are providing interpreting services in that region. It's the same thing with barbers. They have the same exact separation for their LLC and their business, and then they have the same thing as a sole proprietor. Because, for example, their barbershop, they have to keep their own licensure and maintain it for their barbering license. So it's the same concept. And really, technically, it's not a double, it's more or less of how you look at it. Because, for example, when it means to what it takes to conduct your business and what it accustoms and what you have to do in terms of practice, that's not focusing on the interpreting practice. But when you do look, the actual interpreting practice in itself and the LLC and what you're doing interpreting are two separate things, if that makes sense.
Thank you. I do understand that. I understand having to pay for my business, my LLC, and that allows me to do business in the state of Maryland. When it comes to licensure, and that's my right to be able to interpret in the state of Maryland. But you said we do have to pay for our LLC plus pay for a general license. So those payments are actually going to go up starting on the 26th. So to me, it seems like it's a double payment for the LLC plus the general license. Now, that is what I'm trying to emphasize. I think it's a double payment.
Right. So we're talking about business and liability. So what does it exactly protect? And then when you're talking about interpreting, for example, hiring individuals to work as interpreters, that means that you are, for example, you're being accountable for other interpreters and providing services that impact the deaf community. So yes, there are two aspects of it, but when you're talking about that money, it's really to maintain licensure. And also with, for example, the lab portal or the web portal rather, making sure we keep a registry, make sure we have admin, and that's where the money towards the licensure, that's where that money would be allocated to.
Okay, I just think many of us have an issue with that. if we have to submit is there any way we can submit our concerns pertaining to the LLC and the general license? Who do we send it to? The board or SBSLI? Who will respond to us?
So again, for example, if we're talking about sole proprietorship, then you don't have it, and then what it breaks off into. So yes, I can understand what it means in terms of paying for a license, but if you're a sole proprietor, that is completely different as opposed to an LLC.
Many interpreters that are independent contractors have an LLC, but we do not have any entity to where we're hiring interpreters.
So that means you won't have to pay for it unless you're being hired through an agency. That's where it is. Does that make sense?
Okay, I think I got it, but okay, thank you so much.
Thank you. Rebecca? Hello. Hold on one second. Spotlight Rebecca, please. You're good to go.
Hey, everyone. I've been watching the conversation, and we haven't much talked about hospitals, and I'm a little confused. Some of the hospitals have their own interpreters, and they may even have a department within the hospital, and that's a direct hire situation. So they should be considered as an agency, right? And have to have a license? You're saying previously you said the hospitals don't have to do things like other interpreting agencies. However, I don't understand. I think it can cause some issues if they're direct hiring interpreters
Allow me to clarify. So the interpreters must be licensed.
in the hospital.
So in the hospital,
But each
yes.
hospital, they have their own departments, right? Their interpreting departments. So they have
Hmm.
their interpreters in their department of the hospital
Hmm.
that work for the hospital.
So they must be licensed.
Directly hired.
They must be
They
licensed.
need to be licensed. But does the hospital's interpreting department need to register and have a license? And
No,
you're saying no, then that's a problem. You're not considering them an agency?
they're not an interpreting agency.
But
Leslie, did you want to come on?
they hire them in the hospital. This is a great question. And I think it can cause some confusion, some complexity. With the hospital, or really any business, if their primary work is something else and they're providing access. So if you're thinking about a hospital, is for medical services. They can hire staff who work for the hospital as a staff person. And that interpreter could be required to do other work in addition to interpreting, clerical work. Or I know, for example, in my local hospital, those interpreters are also required to reach out to agencies or do some oversight, billing, that type of a thing. That agencies, when we think of agencies, their primary purpose is to hire, contract, and place interpreters in assignments. That's not true. There was a hospital that I went to, and they had their own interpreter. And there were many deaf patients, and that person interpreted for many deaf patients. And that was a staff interpreter for the hospital who was certified by RID. But they were not licensed. That they were in a member of the interpreting services department at the hospital, Leslie. So if the agency, for example, if we're thinking of Holy Cross in DC or Silver Springs,
Silver Springs, Silver Springs.
If Holy Cross, there's a hospital here, and separate from the hospital. They register a second business, Holy Cross Interpreting. Holy Cross Interpreting would be required to have a license, like Gallaudet. Okay, let's say Gallaudet, right? They have the college and they have GIS interpreting. GIS would be required to get the license, but not Gallaudet, the university. I hope that helps clarify. Okay, yes, it does. This is Barbara. Yes, because they're actually separated. They're registered with the state. Their billing is separate from the overall entity, and they have interpreter services. Like MedStar has many hospitals under the MedStar umbrella. MedStar has their own interpreting agency. Excuse me, starting again. If MedStar were to have their own, no, to clarify, the interpreter made an error. Were MedStar to create their own agency, that would have to be licensed. However, because currently interpreters are part of the MedStar group, MedStar, the overall entity, does not have to be licensed. Like Washington Hospital Center, they have a department of interpreting in the hospital building. And they are part of the overall hospital system. I live in Frederick. Frederick Hospital, within the hospital, has an interpreting department. In that interpreting department, there's ASL, Spanish, and all the other languages. They are all hired by the hospital. It is a part of the overall services that the hospital offers. The department is not required to be licensed. If Frederick Hospital were to then set up a separate entity that was Frederick Hospital Interpreting Services, that entity, if it were to be created, would require to be licensed. Rebecca, this is really complicated. Leslie, yes, it is very complicated. I remember they had 3 of their own interpreters that were hired within the hospital. And so I was trying to figure it out. So you have whether or not they had to be licensed. This is Leslie. We're going to add to our FAQs on the website. Hopefully that will help clarify and explain this. But thank you. These are great examples.
Thank
Rebecca,
you.
thank
Thank
you.
you. So now we're going to review our document to make sure that we have answered all of the questions that were posed. 1 second. Leslie going to come on to provide an answer to a question related to how those interpreters who are accepting work through a non-licensed business, are there repercussions for accepting work through a non-licensed business? Leslie?
Well, that's a great question. Just like you register for the web portal, you would register your name and it would be on the list. So if you go to a medical appointment, the deaf person can ask, are you on the list? And they can pull up the list and you can show, or they can see that you are on the list. That will, I'm sorry, my camera. That is the same with agencies. As an interpreter, you have a license, you're offered a job, you look in the web portal for a specific agency and see that they are licensed. You, as interpreters, are responsible to confirm that an agency that is offering you work has a license.
Thank you. So Richie Bryant's going to come on to address the following question. So under agencies and businesses, proof of good standing within the state, what exactly does that mean? And what kind of proof does that require?
So the keyword of proof. Once you register, you pay, and you're added to the list, that means you'll be able to be followed in the portal. You'll have code of conduct, code of professional conduct, and you also see best practices, seeing if they're a good interpreter. And that means if you continue to be in good standing, then there will be an incentive behind that. And again, it's the aspect of proof.
Thank you. Richie Bryant's going to come on to address the next question. Question number 14. I thought that RID managed the compliance with the with the Code of Professional Conduct, and so there's a concern. Are there any considerations for waiving?
Yes. So before I answer your question, yes, Jacob, do you mind slowing down a bit for the interpreters when reading verbatim from your screen? Thank you.
So it says the responsibility is not guaranteed. It's the individual choices. I thought RID was managing the consequences of not abiding to the CPC. I am concerned about the shortage of interpreters due to the financial aspect. Was any consideration to waive or grandfather and welcome those who have the credentials, certification, BA or MA?
Great. Thank you again. And when it comes to that question, and yes, I do serve on the board and I'm on the licensure board, yes. And I'm also a rep for MDAD. And again, MDAD is community-based. And we've been pushing for licensure for a while now. But I do want to caution everyone in advance and be honest with everyone. I am saying when it comes to that clause, it has not sat well with me, especially as a deaf community advocate member. And especially over the years, the community has been done and they've been begging for it, for interpreters to increase their skills, to not cause harm, to, have good agencies, not to ignore the deaf community, but it has continued to happen over and over again. And now we have licensure and we're trying to set it up, but now again, we're trying to focus back on the community. And that has been my struggle, honestly, especially as a deaf interpreter. And I understand from your perspective the impact when it comes to the monetary aspect. And I am aware of that. And when it comes to ASL interpreters in general, they are paid more than any other interpreter. It doesn't matter the foreign language. It could be French, it could be Spanish, it could be anything. Usually it's even in the matter of $20. And putting all that aside is when it comes to, again, interpreters, but my concern is the deaf community we've been asking for licensure for several years, and it's been constantly ignored and pushed and just pushed to the side. And now when we finally have it, and we need to have interpreters vied in and invested and the deaf community both invested. And I can realize the importance of having work, but again, we need to look at this from both sides. Thank you.
Thank you. We'll go on to the next question. So the next question is about clarifying within the state of Maryland and when the law becomes effective on January 1st, 2025. So you must be certified and you're given 7 months, a 7 month grace period to obtain state licensure. So is there any confusion around that you would like there was confusion around that you would like to be clarified? So again, the law goes into effect January 1st, 2025, and the board does acknowledge that. But the regs are currently not ready. And so that means that interpreters will not be penalized for that. So when the regs are ready, that is when it will become officially effective. We, the board, are working diligently on that. So right now, the regulations allot for a grace period to July 1st, 2025, with the regs in their current state. So we are currently looking into a potential postponement as we prepare and allow for the community to prepare for application. So there were questions around the specialty licensure. Yes, there will be more specialty licenses in 2026. The board has voted in a September meeting. And as the board chair, I would like to revisit that conversation during our December board meeting and discuss that aspect with more detail. So there was concerns about the grievance process and who will oversee the grievance process. Will there be a team overseeing issues? And will that include a diverse board, including BIPOC adjudicators? So I would like to clarify, as it relates to the grievance process, I think Richie Bryant has already explained partially about the grievance process. Once a person files a grievance against an interpreter for whatever the reason may be, for noncompliance of the regs or the CPC and the like, a grievance is then filed, and it is not allowed to be filed anonymously. So that grievance is filed and sent to ODHH. ODHH will have a review process to gather information and collect information as it pertains to the complaint or the grievance, and then it will be sent to the Office of Administrative Hearing, OAH, and OAH will then evaluate the grievance in its compliance with the regs and laws, amongst other considerations. And then OAH will make a recommendation to what the result will be based on the findings to all parties involved, the board, and the board will review and make a decision on what action to take. ODHH does not oversee the process. ODHH essentially is just to collect documentation. Ursula will answer question number 31 about paying the annual tax, health insurance. My apologies. Number 32, Ursula will address. So what's the status of the community service facilitation? Ursula?
Can you see me? Are the interpreters ready? Thank you, April. Yes, Jacob? Okay. Are the interpreters ready? Just want to make sure that someone's readily available for me. Alrighty then. We haven't forgotten about communication facilitators, CFCN. The group is fully in support of the deaf-blind community. They recently contacted us. It was delegate delegate Okay, it looks like we have bad captions here because I'm relying on them. Okay, I was contacted by Delegate Kaufman. I did ask about that as well because the legal language is not clear. So at our next licensure or legislative meeting, we will be talking about or getting more information about who, what, when it comes to deaf, blind individuals, hard of hearing individuals, and the Maryland's work group. They will be responsible to collect data and information for the state recommendations and our general council of legislative accountability. General Assembly. You will see that board coming together soon. We're supposed to be making an offer to appoint to the appointment office. That appointment office will be sending you information for those who wants to come and be on the board. Therefore, we can select those members. That meeting will be commenced soon. Again, we've recently made this offer. When they start working on that, then you will see an announcement sent out about meeting dates and times and discussions that's been had. We invite all those that are interested to join us as we continue to give recommendations for the state and for us to include deaf-blind individuals. Thank you so much.
Thank you, Ursula. So our next question, well, we have two of the same question. So if there's an agency outside of the state of Maryland providing interpreter services within the state of Maryland, do you require licensure within the state of Maryland to run and operate and hire businesses and staff interpreters within the state? So I will allow Leslie to answer that question.
Great question again. A lot of great questions today, so thank you, everyone. Any business, agency, or interpreter doing business, providing interpreter services in the state of Maryland for people in the state of Maryland must have a license. So, for example, we've talked a lot about VRI. If VRI business in the state of Maryland is established and providing interpreter services in the state of Maryland, however, the business exists in another state, Virginia or other state, the agency would be required to hold a Maryland license. That would be the same thing if an interpreter lived in New York, however, provide VRI services in the state of Maryland. They would be required to have the general license. And then there is a second question. Someone asked, if you hold a Maryland license, would you be able to work in other states? If you were to work in another state, you would have to look at their requirements. Some states will have reciprocity, which would allow, if they honor the Maryland license, then you would be able to work in that state. And then Maryland can make a determination about reciprocity for people coming here from another state. I know that was a big question in a conversation regarding who lives where and where the deaf person individual is and where the agency is. There's a lot of that on our FAQs, and you can find a lot of answers there. And I'll hand it back to Jacob.
So we will proceed to our next question about members of the Educational Interpreter Work Group. We have a representative from the public. So we wanted to invite Sue to answer that question because she works with that particular work group. So Sue, the floor is yours.
Okay, thank you for your question. The educational work group is and that's for several educational interpreters within the system, and I am included in that. There's also other members. There's Beth Ann Mann. Amy Crooks, Renee Gordon, and Selma. I apologize profusely, Selma. I don't remember your last name or how it's spelled, so my apologies. But those are the current individuals working within the system or in the schooling system. So we've gotten a lot of feedback and input from the educational interpreters that's currently working in the field.
I want to thank your work group who has helped us to make these informed decisions
Yes,
and
thank
the
you.
development of the regs. Without the work group and the input and feedback, the board would be up a creek without a paddle. And so thank you so much for your feedback and your insights for consideration. I'm so thankful to that work group.
Yes, thank you.
So there was a question about public schools, the public school system. Yes, we have several representatives, and Sue did touch on some of those. We have Amy Brooks from the Federal Council of Public Schools. We have Selma from a, a county, a public school county. We have David from Howard County, And so we have a wide set of different perspectives providing input as it relates to that. So thank you. So we're going to hold on the list of questions and tend to those who have their hand raised currently. Eddie Martinez, the floor is yours.
Hello. I just wanted to clarify and just back up a little bit about my complaint. The point that I was trying to make is that if we send it to ODHH and you're going to be accepting data, evaluate it, and then send it over to GODHH, and then we're going to give it back to the board. So I just want to know who are the names of the individuals that is on that board that's going to be interpreting that data. Richie Bryant's going to be answering that question for you.
Thank you, Eddie. So talking about the grievance process, you will be filing with the Office of the Deaf and Hard of Hearing. And once they collected your data, that will be moved to OAH, meaning the Office of the Association of Hearings. And then they'll be able to look over your case files and see the facts of the case. And then they will go ahead and make a summary decision. And again, the board is not involved in the process at all. It is only OAH that is responsible for the decision in arbitration.
But I thought based on what others had stated that we have to give it to the board. So now I'm a little bit confused.
Yes. So again, the board just has the regs. And we have to be in compliance with the laws that Maryland sets. That's all the board is responsible for. As for the grievance process, again, the Office of Association of Hearings will be the one to handle that. Rather, the Office of the Association Administration of Hearings, Interpreter Clarification, Administration of Hearings.
Right. So that means the board is not responsible for any decision making, correct?
Leslie?
This is Leslie. Eddie, thank you for clarifying. There does seem to be some confusion. When a grievance happens, the individual files a grievance. That file is received, those documents. ODHH receives the grievance and reviews it, making sure that all the required documents are there. That is the end of ODHH's part of that process. Once they've verified all the documents are there, it is then sent to the Office of Administrative Hearings, OAH. They review all the documents and make a determination. That determination, that decision, whether or not there is a violation, that is the decision that they made. There is a violation, there's not a violation. Then they return the information to the board, and the board would then provide those results to the individual or the entity. There is due process. The individual who has had a violation, a grievance or agency that has had a grievance filed against them can follow due process and appeal. However, the board themselves is not involved in determining whether or not a violation has happened. That is the Office of Administrative Hearings.
Thank you so much for that clarification. But you don't mind clarifying the part where OAH does the decision making and the recommendations pertaining to the data. The board members, are they? And what are they adhering to? I believe that is what the question is. Who are those on the board? Excuse me, my apologies, SBSLI. Uh, I know they are also adhering to recommendations. Are they going to be doing that moving forward? Or is it another entity that's going to be taking over that?
Great follow-up question. Yes, OAH makes a determination of what happened, whether or not there was a violation. They also can make a recommendation for penalty or restitution or restorative justice. Whatever the determination and recommendation is given to the board. The board then informs the individual. Again, the board is not making any decisions. It's not a work group. It's the Maryland State Legislature's Office of Administrative Hearings. So the communication passes through the board, but the board does not take any actions.
Thank you.
Well, and Eddie, thank you so much for asking for clarification.
Awesome. Thank you.
Thank you. We're reviewing the list of questions. We have about 20 minutes or so left. So the question that, well, we've addressed most of the questions that have been asked, and we are revisiting some, and some have not yet been answered. And so those that go unanswered today will be added to our frequently asked questions on our website. This meeting has been recorded, so it will be posted on the GODHA's website, and you can revisit this video at a later time. We wanted to answer some more questions, and if there are any more follow-up that is necessary, you can contact the board, emailing the board. The email is sbslimd@gmail.com.
I recently mentioned about reciprocity of licensure. Currently, our board has gathered information about various states and their licensure requirements. At this time, we have not established which states Maryland will accept reciprocity with their license. The board does recognize that many states have similar understandings regarding their state licensures. At some point in the future, we intend to add to the regs and identify which states we will accept their license in a reciprocal relationship. And a similar question, there was one in the chat. If a person lives in Maryland, works in DC and Virginia, are they required to have a Maryland license? No. Only if the services you're providing are in the state of Maryland are you required to have a license.
Again, we want to emphasize the point that interpreter licensure applies to interpreters who work or provide services in the state of Maryland. Leslie?
There's a clarifying question in the chat. And again, regarding the LLC and independent licensure. If you have an LLC and you also work as an interpreter in the state, you must hold both licenses. It is not one or the other. If you work as an interpreter in general, you must have the general license. If in addition to that, you have an LLC, an S Corp, any of those, you must also have the agency licensure. I needed to clarify that. There seemed to be some confusion in the chat.
So now we have someone with their hand up, Philip Meacham.
Hi again, this is Philip. Something just came to mind with this conversation. I had some coworkers that were were getting ready for the CDI exam and had concerns about the timetable for requiring licensure for deaf interpreters. The economic challenges that deaf interpreters face rather than hearing interpreters. In addition, RID, their timeliness with the certification process and processing exam results. There are many that have waited quite some time for their results. So if RID maintains an efficient timeline, it would not interfere with the results. However, currently they do experience a delay in getting results. And how has a licensure board considered this if an individual is waiting pending results? Do you know what I mean? Do you understand my question? Do deaf interpreters, can we get some more time?
Richie Bryant will answer your question. Richie?
One thing that we do have is something called a provisional license, and you can have that for up to 5 years. That means while you're in the process of testing, certifications, you have a 5-year window. And then again, that's just really an opportunity to get your license in that grace period. So once your license is done, and then therefore you have to move on to the next step of the process. And then again, with RID, there's to be transparent. I used to be the RID president. And really, when we're talking about RID, we're really talking about Castly because they're the ones who conduct the tests and also who change the format in terms of developing the cycle and also when they release tests. And really, they do have a predictive timeline of exactly what's going on, but there's several reasons as to why certifications have been on hold. But now that's not the case. Now we have the money ready. Now it's also the case that we have the staff, we have the infrastructure, and then therefore everything has been able to be set in motion. So therefore, it should not be up for recess again. There should be no pause. So that is, I hope that answers your question.
Yeah, maybe. I think so, yes. And I'll certainly follow up with an email.
Great.
Thank you. So we are reviewing the list of questions. And it seems like a lot of your comments and concerns are related to the agency and business component. So maybe we can have one of our board members, Richie Bryant, to clarify and reiterate the business and agency aspect again. So Richie, would you mind explaining the LLC, S Corp, agency, etc.? Thank you.
Before I go in about the LLC, the S Corp, and so on, I do want to make a clarification. I recognize in statements when it comes to taking the test and regs and then the results, the certifications, passing, it's usually within 2 months. So give or take 6, 8 weeks, that seems like to be within the timeline. Now it seems to be the confusion with an LLC. So suppose I established a business and it's a sole proprietorship. And the intention of this business is to get tax benefits. And that's why I set up, or rather, an LLC. And then I get my interpreter license for my person and my person only. I'm not creating myself and becoming another entity. It is simply just for the purpose. I'm not hiring any other interpreters. It is only for me to contract with other interpreting agencies. That's the purpose of my licensure. Now, if you were to establish an LLC, an S corp, and then when you do hire and you start to become an entity, that's where you transition into, as opposed to one person to an agency. Again, that's the employment aspect. And again, conducting business in the state of Maryland means that if I happen to be an interpreter and I'm only doing it for myself, but then I have a secondary business for my own interpreting agency, and I'm the one who's responsible for doing the hiring, that's where the separation needs to take place between my own person and where the business stops and ends.
Thank you, Richie Bryant. We have one more person with their hand up, and then we're going to wrap up. Gavin,
Uh,
1 second, Gavin, 1 second, Gavin.
okay, great. Richie, answer my question. I'm an LLC or an S corp, and I'm only working as an interpreter. I'm not working with any other interpreters and earning a profit from that. Then, if I'm sorry, say it again. Interpreter asks for clarification.
So to clarify,
Mhm.
If I'm not hiring or contracting with anything, I'm just a sole proprietor as an LLC or an S corp. I do not have to have dual license as an interpreter in an agency. If I am hiring or contracting other interpreters and placing them in additional jobs in addition to my own job, then I would be required to have both licenses. Yes? Great.
Yeah, that is correct.
well, please hold while the board deliberates, and we're going to go on to answer the next question. Okay, so now it seems that we are coming to a close and we want to wrap up and thank all of the interpreters for joining today's town hall. I hope the board was able to clarify some of your questions and your concerns. Again, we will add some of these questions to our FAQ list on our website for a follow-up at a later time. We will be hosting 2 more town halls, November 22nd and December 19th. Nice. And so we will announce those town halls closer to those dates, and we look forward to seeing all of you all there at those subsequent town halls. If you have more questions, again, feel free to reach out to the board. And our email is sbslimd@gmail.com. And open comment will open soon. And so I hope that you all will be able to submit your formal comments as well through the Maryland Registrar website. So we do have our draft of the regulations on our website for you all to review and peruse. If you have more comments to make or questions, feel free to send them to the board so that we can address them and we can have an open dialogue or exchange with you all. Again, thank you so much for coming. Thank you to GODHH for supporting this effort and all of the work that's happening behind the scenes. Are there any more points of clarification? We look forward to see you all on November 22nd and December 9th. That will be announced formally very soon. Thank you so much and have a wonderful Sunday.